Opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning. Good morning. What a beautiful morning in South Florida. Sunset is going to be around 7:15, 7:16. So if you have the luxury of opening your window and looking to the east, you're going to enjoy a beautiful sunset, and it's going to be a beautiful weather. It's going to be in the low 80s, even though I'll be going to New York after I see my patient and probably start working over there and come back right away. So Monday, we are open, and I think, Ina, you put Anita in the closet so you can be my co-host today.
Yes, good morning. I sure did. Hi, Anita, if you listen to us.
We'll keep you locked in the closet for the next half hour, so we can give Ina a chance to shine. So the spotlight will be on you, Ina.
To shine.
Yeah. So, first of all, to the people that had been calling the station, with regard to the Boynton Beach, yes, we are officially open. Is 12453 Hagen Ranch Road in Boynton Beach, Florida. The phone number there is 561-270-6494. So pencil talk, ladies and gentlemen, let's jog it down for the people in West Palm Beach. Is 561-270-6494. And, of course, our Fort Lauderdale office, everybody knows, is 954-489-1345. Ina, first of all, I think, you guys have done a wonderful job with the new ad. Congratulations. It's beautiful. And for those people that get Boomer Time, they can see the ad on page 5. And now it's had to be restructured. It's a few changes on the ad. I really, really love the ad. And people will notice that one of the things that we have done is change the name of the practice. Still the same system, same philosophy, same missions and everything. So what's our new name?
AGI,
Mm-hmm.
Medical and Dental.
AGI, Medical and Dental. And basically that's abbreviated because A for adult medicine, we do adult medicine, young adult and aging adult. And then it's an institute, so Adult and Geriatric Institute. So AGI, adult medicine. The website, I believe, still being served, even though geriatrics.com is open. The new website is going to be AGIFL for Florida.com, www.agifl.com. It's going to be our new site. And from what I heard from Dr. Rosemary, she's already seeing patients. As of yesterday, we got the license on Thursday. So the license is in, they pass all the inspection, they're ready to go. So who are some of the doctors, Ina, that have already been there, seeing patients besides Dr. Rosemary?
So Dr. Masco is our primary care physician in Boynton Beach location. He had a few patients yesterday, and he has his schedule for the next week.
Beautiful. And he's also a nephrologist, right? And Dr. Hernandez, the ophthalmologist.
Dr. Hernandez will be going there one day a week. And Dr. Joseph,
Dr. Joseph, the podiatrist,
will be there also once a week.
Okay, so they are all lining up,
Yes.
ready to come.
Slowly but surely.
They are coming. They are moving north.
Yes.
We better watch out. Well, the practice basically our our whole heartfelt intention is to bring the services that had been so well accepted and loved by the people of South Florida, what we have been doing here in Broward County, basically covering the Tri-County. But so many people coming from up north, it prompted us to open our next center in Boynton Beach. And I think, we have to congratulate Mike and Dharma, Rosemary, and you, because you guys have done such a great job in taking, the new office off the ground so fast, so smoothly. Everything had gone so smooth, and I know Mike from the dental department have put so much time into this, so much overtime, into this. And also, if you look at the Boomer Times for October, there is a wonderful article by Dr. Rosemary regarding sleep apnea. So please do take a look at that article. It's a life-saving issue. And also a lot of people with sleep apnea, they have a tendency of developing hypertension, heart disease, lung disease, kidney disease. So many organs can be affected. And it's like a silent killer. So, read the article, look at the advice Dr. Rosemary is giving. And we are at the center, at either center, we are able to perform the test. And the fear with sleep apnea had been the fact that we think that the only answer, once we know we have it, is that we have to wear a mask. Mm-hmm. And that's not quite so. There is a device that they are doing in the dental department, right?
Yes.
And so the patient come in, they get the sleep study done, the result come back, they come back, and before...
Doctor reads the results and they tell you if you do have sleep apnea or you don't.
And then once you get diagnosed, then now they put the device in your mouth. Mm-hmm. Instead of a mask, it's a mouthpiece.
And it's much more convenient. People hate wearing the mask.
Right.
They're like I'm like in space.
Right, exactly. Right, like a space mask.
Yeah.
And not only that, the other thing is also, if, a lot of people still travel, whether,
mm-hmm.
you are old or young, or, you have sleep apnea, you like to travel, visit family, or because of your profession or what have you, and you have to carry all this equipment with you if you're going to be gone for a while. So here you just carry your little mouthpiece and put it in your purse or your suitcase or what have you, mm-hmm. and just bring your mouthpiece with you. And when you go to sleep, just put it on. And you don't need anything else. You don't need any equipment in the room. You don't need anything but your mouthpiece. And if you're going to make love with your partner, you just take it off and make love and put it back on your mouthpiece, right?
Like a dangerous.
Denture, usually we put it on when we're going to make love. Here, the mouthpiece, you
have to take it out.
Take it out when you're going to make love. That's the difference. So people won't get confused.
Anita would like that topic.
Anita would love that topic, but let's keep it in the closet for the next half hour so that we can have fun here, you and I. So the people that are tuning in just now and are calling the radio station regarding the Boynton Beach office, we are officially open. We opened yesterday. We have seen some patients yesterday. We got the license and all the credentials were met on Thursday, so we are up and running. We have met with a few cardiologists and vascular specialists and different people already very interested in working with us. We also have met with some dermatologists that want to come in. By the way, for those people that come to the Broward office, Dr. Abovian, the dermatologist, will be there seeing patients. Today we have Dr. Abovian. I believe dental have a few patients. I'm not sure.
Dental has a patient today.
The patient
dental
has
is
a few
open
patients.
Today. If anybody has an emergency, they can come in.
Right. Or if they just want to come in and get checked.
Of course.
right? If they just want to come in. Some people like to just get their stuff done on Saturday. So Mike will be there in dental, and you can come and see him. Their phone number, again, is 954-489-1345 for the office. And we'll be there half a day today, like every Saturday. And, the ultrasound department is open.
Yes.
Uh,
And as
people-
of next week, we're going to have a podiatrist on Saturdays.
Oh, yes, Jeffrey.
Yes.
Yeah,
A
we
new
have.
doctor.
Great guy.
Yes.
Great guy. Very nice personality. Right?
Absolutely.
Yeah.
Yes.
So we are happy to have him. He's going to be coming on Saturdays.
Yes, we're having more and more doctors who wants to work on the Saturdays and do the house calls for us.
Right.
So
Yeah. And tell me about the house call. Right? Yeah, it's like every week you guys are getting more and more patient on that area. That department keep growing.
yes, and Dr. Moskowitz was the one who really put a lot into this,
And,
he
Juan.
developed that. Yeah, and Juan.
Juan.
Yes, they have a good team working together, and
But anybody make a great team with Dr. Moskowitz. He's
Yes.
such a humble guy.
yes,
Such,
and
you
he
know.
has such a nice sense of humor. I like him,
Yeah.
and he speaks so many languages.
Yes.
I like
yes.
it
He's
about him a lot.
multilingual like
Yes.
us. Yeah. He's a nice person, very nice person. And Juan also, Juan is so committed to the practice for so many years.
Mm-hmm.
He has been so loyal to the practice. And the patient, they just love him. And people understand that, he knows my practice so well that in order for the Boynton Beach to basically follow the same mission, same
Exactly.
philosophy, I need Juan and Homer there so that they can assist Dr. Moskowitz, continue to do the same philosophy
Exactly.
and culture of the
Practice.
of the practice. So yeah. So how many languages do we have now in
In the office,
In the office,
a lot.
like we have German.
We have
German with Dr. Moskowitz, so you have to go to
Yes.
the Boynton Beach first. And he also speaks French and a little Russian, right? You speak
Yes.
Russian.
Mm-hmm.
Tina speaks Russian,
Yes.
Ukrainian. Walker speak Portuguese.
Portuguese.
We have Spanish speaking. We have French speaking.
Yes.
Our new house doctor.
The Dr. Richard.
He speak Polish or I know he speaks some.
Oh yes,
French.
he speaks
Yeah.
Polish, and he speaks quite
A few
a few
He
languages.
speaks
Yes,
few languages.
everybody is multilingual.
Multilingual. Also for the people out there, there's a lot of people that come to this country and eventually they need to get their citizenship or naturalization papers or what have you. We are going to start doing the immigration medical physical examination. Since we just got that license, so we're going to be doing that for the community. And our services, they just keep growing and growing. It's so beautiful, so wonderful. The company keep growing and very solid in Broward County and basically covering the Tri-County now. What else we have? We have the neuropsychologist. We have not really spoken much of him.
Dr. Prima.
Dr. De Prima. Nick De Prima is a neuropsychologist. And for the people that don't know, basically he's a psychologist. And he does some special training where people that have problem with their memory. The other day I sent a patient that they thought she was demented. But in reality, she was very, very depressed. And I put her on antidepressant, and then her quote-unquote memory problems started disappearing. So it's what we call pseudo-dementia. It's not a true dementia. It's a forced dementia, masqueraded by the depression. So he's able to do this long procedure, long test, 1 to 2 hours.
Yes, sometimes up to 3
battery,
hours.
right, test. And then he'll sit down and go over all the answers and report from the patient and feedback, and then he put together a wonderful report that we are able to use as geriatricians to better serve our patients so they don't get mislabeled as being demented or being depressed. Some people, unfortunately, have both diseases, and we have to make sure we manage both because that's the only way we're going to give them great quality of life. So, and Dr. DePrima, he's basically this is from
Yeah,
he
we
hit
have
the
a very
floor.
good feedback from the patients. They love him.
The patient
He's very
laughing a lot.
nice.
He's
Yes,
yeah.
and the staff likes him. He's a nice person.
Well, you really know how to pick them. So I usually send all the consultants to go by you in, and you have you and Dr. Rosemary. You guys has a good sense of detecting who is going to be a good team player and who is not. And sometimes I want to contradict you guys, but at the end I always give in and say, they really know what they're doing. So
Let's give them the chance.
yeah. So yeah, with regard one of the questions that was asked in the new office, the ancillary services that we have. We have a lot of ancillary services. We can do ear lavage. We can draw blood instead of sending the patient to those
Yes.
labs. We can do it right in house. In the new office, we are going to be doing those things. We're going
Exactly the
yeah,
same services.
the same services. We're going to have the ultrasound
The lab
department.
in-house, the
Yeah.
ultrasound.
Oh,
um,
ear
we do
lavage,
AKG.
the EKG, we do
Yes.
echo for the heart, check the carotid if you're thinking that you have any blockage in the neck. The carotids are so important because it's the main artery that brings blood to the brain, and you have one on each side of the neck, and we have to check those to make sure they are patent, that there's no blockage being formed in there, and if it is, so that we can start managing that. And one thing that Dr. Mascoy and I share in common is that we both like holistic medicine. So I have noticed with some of the patients, he have offered them a holistic approach to care, and cannot wait to have him on the show. He's gonna be a riot. We're gonna have fun with him. So.
Let's give it one more time the phone number for the new office.
Okay.
Like you always say to Anita. Stop talking, give the number.
Give me the number.
The number to the new office is 561-270-6494. And the number for the Fort Lauderdale location is
So how you say
954
that number in Russian? The 561.
561 270 6494.
6494. Okay.
Yes, and Fort Lauderdale we are open on Saturdays.
For Lauderdale, we're open on Saturday. Both Dr. Masqué and myself, we both are going to be able to continue to provide the services of the house call, or I should say both offices will provide the services of the house call when needed. For those patients that are homebound, and also those patients that are not homebound, but they get so sick that they are not in the hospital, they are at home, but they are so weak to come to the office. They can call and request a house call. They just need to understand that they will be put on a schedule that is not like an emergency,
Yes,
that's same
immediate
day.
thing.
It's not same day, unless the doctor happen to be in the area and the phone call come in early. If we can accommodate, we try to accommodate for that. And, we try to do what we call the continuum of care. That is so important in geriatric medicine. So when you are at home or in your condominium, we'll be able to see you there. But if you go to an assisted living facility, if you go to a nursing home, if you go to a rehab, we want you to come to places where we're still on staff, so that when you are there, will you continue to keep the services that we are providing. And it's like a menu when you come to see Dr. Moskowitz. If you have your dentist that you love and want to continue to care with your dentist, that's fine. If you come to the dental department and you have your primary care doctor and you want to continue with your primary care doctor, that's fine. So it's not like all you have to accept all of the services. The services are just there for your convenience and for you to basically feel free to select, like when you go to a restaurant, select from the menu what is it that you want. Do you want seafood, or do you want steak, or you want vegetarian? Select what you want, and you can pick and choose. And the good thing, like yesterday, we had a patient that came in for medical, and she had she had pain right above her uh, in her gingiva, and it looks like a little abscess. And she does have a dentist, and the dentist is in downtown Miami. I say, listen, we have a dental department. You don't have to leave your dentist, but if it's an emergency and you want to get seen, I can make sure you get seen today. And she took opportunity of the fact that we are there, and it's a staff that already know who she is. So she was able to go to the dental department, get X-ray. They were able to diagnose us with a little abscess, put her on antibiotic. And it's so important for me as a physician, because what we have done is salvage a tooth. Because sometimes when you develop those, really nasty abscesses, people can lose their teeth from the abscess. So, services are there. You can pick and choose. And if you ever have an emergency and you have a cone in your food that is bothering and you need that to be taken, come and see the podiatrist. And I usually recommend to all of my patients that have diabetes to make sure that their podiatrist and the ophthalmologist see them at least every 3 to 6 months, not once a year. Once a year is a general checkup for all of us. And, we need to see the podiatrist frequently. A lot of time can prevent us from having surgery in the future. So think of that way. It's a service that is covered there, it's covered by your insurance. They are not charging you more money or less money. Just the service that you have there. And, sometimes we are so afraid to practice preventive medicine. We think the insurance is going to get mad at us and drop us. No, on the contrary. Insurance company, they like when their members are proactive in preventing major disease, because major disease, as you know, tend to be very costly. So if you develop a major disease and you have an enlarged heart, and when you sneeze or cough or laugh, you develop congestive heart failure. Every time you develop congestive heart failure, you're going to end up in the emergency room. From the emergency room, you're going to end up in intensive care. And if you add up the cost of taking care of that patient, it's a lot more costly than when the person comes and practice preventive medicine so they don't develop that. It costs more money to do dialysis to a patient than to treat the patient with early stages kidney disease. And then what we do, Dr. Moskowitz, myself, the rest of the staff, is basically what medication can we use on the patient and what medication we don't want to use on the patient. I have seen so many patients that because they get the wrong dose of antibiotic, they end up with renal damage. And it's a sudden renal damage. So they have some underlying base renal disease, which is what we call chronic kidney disease. We superimpose acute renal failure. And that's really nasty. It's a bad situation to be in. It takes a lot to treat those patients. But the problem is that they end up having the kidney function, once they overcome the situation, if they survive, is going to be now worse than when they come into the hospital. So before we leave you, remember AGI Medical and Dental Center, the one in Boynton Beach, is officially open. We are open. The number is 12453. The address 12453 Hagen Ranch Road. It's in Boynton Beach, Florida, and we are about 2 miles south of Boynton Beach Boulevard, and it's at the public shopping center. and their phone number is 561-270-6494. The Fort Lauderdale office, we are at 1608 East Commercial Boulevard in Fort Lauderdale. And the phone number there is 954-489-1345. 954-489-1345. The Hagen Ranch office will do Saturday hours upon request, but for now they are open Monday through Friday, where the Fort Lauderdale office is open 6 days a week. So Boynton, Monday to Friday, we are 6 days a week. We want to thank you. We can let Anita out of the closet in a few minutes. Thank you for listening to us, and we'll see you live again next Saturday. God bless you all.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.